Welcome back to another series of CPT modifiers. In this series, we will discuss modifiers 58, 59, 62, 63, 66, 76, and 77. In this video, we also have a question and answer session to further strengthen your knowledge. Welcome back to my channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In our last two videos, we have covered some important modifiers and their functions. Today, we will further explore additional modifiers that are commonly used in medical coding. Let's get started. Modifier 58. CPT modifier 58 is also known as staged or related procedure or service by the same physician or other qualified healthcare professional. The performance of a procedure in the post-operative period was planned at the time of original procedure, more extensive than original procedure, for therapy following a diagnostic surgical procedure. Modifier 58 is used to indicate an expected return to the operating room to complete a procedure in stages. Let's take an example. Breast biopsy was done on 2nd March and a planned modified radical mastectomy on 6th March. We will add modifier 58 to the modified radical mastectomy as it is staged or related procedure. Common keywords used in the procedure to add modifier 58 is return to the operating room, will proceed with additional services with next procedure. Modifier 59. CPT modifier 59 is also known as distinct procedure service. It is used to indicate that two or more procedures or services were performed during the same encounter, but each procedure or service was separate and distinct from the other. This modifier is typically used to indicate that a procedure or service was performed separately and should be reimbursed separately. To apply a modifier 59, procedure should be done in separate session, patient encounter, different sites or different organ system, separate incision or excision alien. Let's take an example. Colonoscopy with the removal of polyp in the transverse colon is by snare method, and the rectal polyps were removed by biopsy forceps. Here, different techniques are used to remove polyps. We may code each technique done in different areas of the colon. So in this case, we will add modifier 59 to the second code. Keywords commonly associated with CPT modifier 59 include distinct, separate, independent, unrelated, different procedure. Modifier 62. CPT modifier 62 is known as two surgeons modifier. It is used when two surgeons work together as primary surgeons performing distinct part of the same procedure, or when one surgeon performs part of a procedure and another surgeon performs a separate but related procedure during the same surgical session. We will apply modifier 62 to both CPT codes. Let's take an example. Two surgeons working together perform a partial esophagectomy with cervical esophagostomy without reconstruction. How we will report this service? We will add the modifier 62 to the both CPT codes to show that the two surgeons are working as a primary surgeon. Keywords commonly associated with CPT modifiers 62 are co-R2 surgeon, dual procedures, shared surgical responsibility, combined effort, joint surgical procedure. Modifier 66. CPT modifier 66 known as surgical team modifier. It is used to indicate that multiple surgeons, usually of same or different specialty, work together as a team rather than one being the primary surgeon and the other assisting to perform the surgical procedure. An example of CPT modifier 66 would be a complex surgical procedure such as liver transplant, where a team of surgeons from same specialty such as transplant surgery collaborates to perform the surgery. Each surgeon actively participates in different aspects of the procedure with no single surgeon acting as a primary surgeon. Surgical team collectively perform the procedure, acknowledging the shared responsibility and collaboration among the surgeons involved. Each surgical team member should submit the same procedure code with modifier 66 indicates that a team of a surgeon was required for the procedure. Keywords associated with CPT modifier 66 include surgical team, multiple surgeons, team or collaborative surgery, shared responsibility, group procedure, collective surgical involvement, and joint participation. Modifier 63. CPT modifier 63 known as procedure performed on infants less than 4 kg. This modifier helps in adjusting reimbursement for procedure performed on a very small infant, acknowledging the additional complexity and potential risk associated with operating on such tiny patients. Let's take an example. David, a 5-year-old, was born prematurely and weighed 3.8 kg. Dr. Daniel performed cardiac catheterization on David. In this scenario, we will use the modifier 63 along with procedure code to indicate that the procedure was done on a premature baby. Keywords associated with CPT modifier 63 include less than 4 kg, bed based, incubator, newborn, or premature. Modifier 76. The CPT modifier 76 is used to indicate a repeated or subsequent procedure by the same physician on the same day or during the same session. Let's take an example. If a chest X-ray is performed at 7 a.m. and read by Dr. A, and at 10:30 a.m. another same chest X-ray is performed and read by Dr. A again. Test was performed 2 times by the same physician during the same day. We will use two CPT codes along with modifier 76 to the second code. It will indicate that it was repeated by the same physician on the same day. Common keywords used in the procedure to apply modifier 76 is repeated by the same physician in the same day or same session. Modifier 77. The CPT modifier 77 is used to indicate a repeated or subsequent procedure by another physician on the same day or same session. Let's take an example. On the same day of service, if a chest X-ray is performed at 7 a.m. and read by Dr. A, and at 10:30 a.m. another same chest X-ray is performed and read by Dr. B, we will use two CPT codes along with modifier 77 to the second code indicates that it is repeated by another physician on the same day. Common keywords used in the procedure to apply modifier 77 is repeated by another physician on the same day or the same session. If you have any question or need further clarification, feel free to reach out via email. It's time for a question and answer session. Let's get started.